Good morning, good afternoon, and good evening, everyone. I'm Abla Sibai, the Dean of the Faculty of Health Sciences at the American University of Beirut. It's my pleasure to welcome you today's webinar on health and humanitarian response in Lebanon. This webinar is co-organized with the Center for Humanitarian Leadership in Australia, the Hopkins Center for Humanitarian Health in the US, and the Geneva Centre for Humanitarian Studies. And I'm so delighted to see such a large group of attendees joining today. For those of us living in Lebanon for the past 50 years, I guess it has been like continuously waiting for the next crisis. We have been only questioning, when will this happen? But with each cycle of violence, it has been another test of our resilience and of our ability to adapt. Also, being Lebanese has always meant that we must repeatedly oscillate between destruction and rebuilding and between despair and hope. However, this current large-scale Israeli attack on Lebanon has been much more brutal and much more aggressive in its war machinery and its targeting of civilians and the health sector. It has brought much more destruction, more deaths and injuries, and more displacement. And except for hollow condemnation by some communities and international organizations, there seems to be no urgency to change this course of warfare anytime soon. Yet, as public health professionals, we continue to do what we can control, not only as a means of survival, but also as an act of defiance. In this webinar, we will hear from our esteemed colleagues what are the immediate and long-term humanitarian needs in Lebanon, ongoing response efforts, urgent care gaps, and what are the challenges and the lessons learned. I will not speak more. I will hand it over to my colleague, Dr. Fadi Jardali, Professor of Health Policy and Systems at the Faculty of Health Sciences at UB and the founding director of K2P, the Knowledge to Policy Center, to introduce our esteemed speakers and get started. Over to you, Fadi, please.
Thank you, Dean Sibai. Welcome, everyone. Good morning, good afternoon, depending where you are. And I'm just trying to fix one thing because I know that the ministers had the challenge of accessing the session. So Gina and Muhammad, please, if you can, because they are being requested to put a password to enter the panelist session. So just make sure this is resolved, please, from an IT perspective, because they are waiting. Okay. No. Thank you so much for the for your time, for your presence with us. This is really quite an exciting and timely event, in light of the brutal aggression that we are really living here in Lebanon. So what we will be doing, so we have only 1 hour, so we'll make the best use of this time. We have, distinguished panelists and speakers and 2 ministers, and I will actually introduce them just to set up the scene. So we thought maybe just to share with you why we are actually doing this this plenary today, and what we want to make sure that some of the key messages that we want to actually get of this. So let me just share my slides. So again, this is really about the current humanitarian response that we are actually living. This is a current reality. We have a brutal aggression. We have one of the worst humanitarian crises in recent history in Lebanon. We have emergency response, and we have efforts that are really taking place at the governmental level, institutional level, at different level. But at the same time, we have also priority areas for action. The question really how to strengthen Lebanon humanitarian response, and what is the role of the local and international stakeholders, so we can achieve a much more tangible impact. Unfortunately, we call it living reality, because everything you're gonna see now and everything we're gonna speak about in numbers, this is really changing, unfortunately, by the day. Situation in Lebanon has been, as you know, escalating dramatically over the past few weeks from the attack from Israel. The deaths has surged by over 200%. We have a significant destruction at all levels, including for the health infrastructures. Again, in terms of casualties, we have unfortunately, again, I have to say that the numbers are changing by the day. But so far, we have more than 3,000 deaths, martyrs. We have more than 13,000 injured people, and we have large number of women, men, children that are really impacted by this by this crisis. When it comes to the health infrastructure, unfortunately, despite significant efforts, but there are some hospitals that are really out of service. We have hospitals that are really being attacked. Some of them are partially operating. So 15 hospitals have been really quite damaged. We have around 98 primary healthcare centers and dispensaries that are closed so far. We have several healthcare personnel that were really that died. They are martyred. We have several health personnel wounded, so around 306. But again, this number is really changing. Significant number of attacks on healthcare facilities. And we have also the paramedics and the emergency system has been really impacted as a result. We have one of the, again, worst emergency crisis, but we have large number of internally displaced person, around 1.2 million, 52% are really female, and 400,000 are children. And we have a really large number of displaced people. Some are registered. We have large number of pregnant women, and Dr. Kak will speak more about that. So far, around 4,000 are expected to deliver in the next 3 months. We have really significant number of water facilities that are really damaged. The number of buildings, actually many villages are being completely attacked and even destroyed. We have large also losses when it comes to agricultural land, among other things. Again, we have the humanitarian funding aid. The numbers are also changing. There was a destruction to the infrastructure, housing, and all the productive sectors. All sectors are being impacted. But the losses and the aid required is also changing. So what you see here in terms of numbers, this is also it's a more of a moving target. But we know that Lebanon required around 250 million per month to support over 1.2 million displaced individuals that are really affected by the conflict. Not to say about what are really the implications, social, economic, and others in the next few years when it comes to the actual recovery and the post-war era. So when it comes to the humanitarian funding aid, we know that the France conference on aid raises around 1 billion, but again, nothing yet was received by Lebanon. There are different modes of how this money will be allocated and condition among others. But we know there's 200 million for the Lebanese army and among other type of packages, emergency packages from the European Union, etc., etc. But again, there's urgent need that is really required. This is where we are. I'm sure we're going to learn more about from the panelists. So I'm so delighted and I'm actually privileged to have this really moderate this panel today. We have really distinguished panelists. We have people that are really working day and night when in facing this crisis. So we have Dr. Nasser Yassin. Dr. Nasser Yassin, he's the Minister of Environment, but also he's the head of the National Disaster and Crisis Response Operation Coordination Committee, working non-stop as well to address many of the emerging needs. We have Dr. Firas Abiad, Minister of Public Health in Lebanon, that he's really at the forefront of actually fighting this war, but supporting and making sure that we have a health system that is really resilient and able to respond to the needs of the population. We have Dr. Zainab Hanna. She's the Executive and Administrative Board Member at AMIL Association International, and also she's a lecturer of Political Science and Public Administration in UB. And we have also Dr. Faisal Kak. Faisal Kak is really also a clinical associate of obstetric and gynecology, and he's the director of Women Integrated Sexual Health Program here at the American University of Beirut, and he's also a lecturer at the Faculty of Health Sciences. So we're challenged a little bit by time, so we want to make sure we run this panel in a very efficient way. After this, brief, I wouldn't say keynote, this is more of setting up the scene where we are. So we have two rounds of discussion. The first round will be on overview of humanitarian crisis and the response efforts so far. There will be questions specifically for the panelists, and then we're going to go into round two with the unfinished business and the challenges and what are really the priorities when it comes to the humanitarian response. And at the end, we're going to end up with really key priority that we want to make sure that everyone, local, national, international community know about, and hopefully we'll have some time as well for Q&A from the panels. So I just wanted to make sure that hopefully, again, welcome, Minister Abiad. You are with us already now, and I think we're still waiting for Dr. Nasser Yassin, correct, Rina?
Yes, our IT is right now in contact with him, and they are trying to log in.
Okay, thank you. Thank you so much for this. So let me start by you, Dr. Firas Abiad. This is really when it comes to the current humanitarian crisis and response effort. I know you just came from also a cabinet meeting today. There's a lot of emerging needs and urgent meeting that you have to attend to. So thank you so much for being with us. So with the Lebanon healthcare system, that is really, we just mentioned that it's really under unprecedented strain. Could you outline to us a little bit some of the critical challenges that you are facing as the Minister of Health in delivering care to those who are really at need now? How the ministry working to protect its healthcare facility, how to protect healthcare workers, critical services, particularly in the areas of Lebanon that are really under attack. So want your thought on that. At the same time, to make the best use of your time, we would like to also hear from you about the top priorities for building resilience for this. What is needed from the international community? How international partners can actually allow you to address some of those emerging needs, and also addressing and responding to needs and providing services, particularly in critical areas, and making sure that we have really resource mobilization and sufficient resources, as well as sustainable delivery at the time of the attack. Over to you.
Thank you, Fadi. So in the interest of time, I'll move directly into the subject. First, we have two different fronts that we are addressing. The first one is meeting the needs of the injured. As you know, the war on Lebanon is ongoing, and on a daily basis, we are reporting a large number of people who have been killed or have been injured. And these are, we have to address that. And on the other hand, we have, as you mentioned, almost 1.2 million internally displaced people who also need, they have health needs, whether it is cancer, whether it is chronic medications or diseases that needs to be addressed, delivery, and so on. So the ministry has to address both of those. And this actually is places a lot of requirements on the already diminished resources that we have because of the other crises that we are actually facing. At the same time, we have to do this at a time where our facilities, our personnel, our healthcare colleagues are being under continuous attack by Israel. And we are seeing, where some of our healthcare facilities are being put out of service, like or being directly attacked, like what happened just a couple of days ago with Tibnin, or for example, in Baalbek, or where we have some of our colleagues, the primary responders, first responders, who have actually died during, being killed as they were doing their duties. Now, our response, in my opinion, there are three issues that are extremely important that we need to talk about. The first one is the availability of resources. And here, I think the international community, what our first need is to have access to more resources, whether these resources are things related to medications, medical supplies, whether certain funds that allow us to improve our operations. The second is, how can you organize these resources? How can you coordinate those resources? And this is something that is extremely important. And this is something, for example, as we were organizing our response to the injuries through the Public Health Emergency Operating Center, you could see that the only reason why we had a good response, for example, to the attack with the pagers, is because we had been mustering a very good coordinated response between hospitals and and the healthcare providers. Finally, I think the third challenge, which is, in my opinion, as important, is how will those resources be utilized? Are we going to, like we saw after the Beirut explosion, create parallel structures where some of these resources will be channeled through, and in a sense, using this methodology, result in a weakening of the same public structures that will be very much required in any future crisis? Or are we going to make sure that these resources that will be made available will be actually used to strengthen the public structures that will be so crucial in the future, and this will make this sustainable? I think that addressing these three areas, resource availability, resource coordination, and finally, making sure what is the role of the public sector as we manage those resources. These are the three key questions that are in my mind. And clearly, finally, what is important that we need from the international community are two things. One is to protect our healthcare facilities and our healthcare personnel, and realizing that this cannot be only sorted on the health front. There has to be a bigger push, more pressure on the other side to allow us to reach a diplomatic solution that will decrease the amount of suffering that everyone is going through. Thank you.
This is extremely important, 3 points, Mr. Abiad, and hopefully we'll have time. I want to come back to it, after we actually finish with round one, because I think it's very critical to come actually and also deep dive into some of the elements that what you mentioned. Let me go to Dr. Kok. I know Dr. Yassin is trying to join. He's not able to do it. There was technical reason from the laptop, but he will be joining from his phone. So we're following up with that with IT. So let me go to Dr. Abiad, Dr. Faisal Qad. Dr. Faisal, we have seen really that women and children face significant critical health challenges during this crisis. And from your perspective, what are the immediate needs for women and children? We're focusing on really vulnerable group, particularly regarding reproductive maternal health and during this crisis. And how this response, how the response can be much more efficient. What will be those response strategies that need to be adapted to ensure those vulnerable groups receive timely and adequate care? Over to you.
Thank you, Dr. Jaldari, and thank you for the panelists. I think, as you mentioned, from day one, we have realized that there is a really sizable population among the displaced. 55% of the 1.2, 1.3 million displaced are women and children, and the 11,600 the population of the pregnant women. And within the Faculty of Health Sciences and within AUB, we have started within the faculty the Ahli Initiative, a Faculty of Health Science Health for Lebanon initiative. And we thought to focus on this important aspect of sexual and reproductive health by first, of course, ensuring a safe access to delivery care, by also looking at the whole follow-up of the pregnancy care, which is being done under the surveillance and the coordination of the Ministry of Public Health. We have also thought of the importance of having menstrual health care. That's also being done. We have been also thinking of the mental health, and the most important thing is the gender-based violence. All of these elements have been put together within a comprehensive approach regarding women's health care. Now there are visits that are taking care of women, young women, girls, and pregnant women. There are also a very close collaboration with the community within the shelters through raising health awareness and education, and collaborating with local community workers who will be coordinating with us. We've been also making sure that there are safe spaces to ensure reduction and less exposure to gender-based violence. And there is also a free clinic at the AUB Medical Center also for pregnant women and also for women's health in general. So this is the typical comprehensive approach where you look at these various needs within the scope of sexual reproductive health, that our initiative as faculty and also within AUD is taken care of. Of course, there are many challenges that remain within high-risk groups within the pregnant women, high-risk groups within women who are interrupted from care, interrupted from cancer care. But I would say that, as you were saying at the very beginning, there is a more efficient coordination at this level. There is an excellent reach out, Fadi, to situations of gender-based violence, which is very important. There is also an excellent reach out to those that are survivors of rape. There are 6 clinics now designed and assigned by the Ministry of Public Health, and also additional 6 to 7 hospitals for those survivors to follow up immediately the clinical management protocol of rape survivors. And that's very important to pay attention to within the response to sexual and reproductive health, in addition to a mental health and focal mental health specialist, even within some of the shelters, who is on coordination with a psychiatrist on call for such a situation, knowing that the amount of the stress from the war and escalation of war on Lebanon that can lead to serious mental health outcome for women and for the community, of course, in general. There are packages and dignity kits that's being provided, in addition to a really so far good working supply chain that acts by push and pull, not only by the push strategy, but also by push and pull to make sure that these are sustainable supplies of family planning, to ensure that people are having no way a risk of unintended pregnancy. So the whole circle is being well approached in close coordination with the Ministry of Public Health, covering, we're talking about more than 1,000 shelters. Okay, in addition, of course, to the services that are not only provided within the shelters, but also allowing people go to the primary healthcare centers that are fully available to this service.
Yes. No, thank you, Dr. Kaka. I think this is amazing. I think this is a country where we have really pluralistic system. We have public, private, we have NGOs, we have the government, despite all the constraints. But at a time of crisis, we come together and we work together and coordinate, and we learn a lot also from the previous crisis. Dr. Zain, I'll come to you, but I need to go back to the Minister Abiad, because he was called for a meeting. I was just addressing you now, and he has to leave in a few minutes. But I wanted to actually get his thoughts on some specific question, and then we'll come to you, Dr. Zaina, and by that time, Dr. Yassin will be joining us. So back to you, Dr. Abiad. I don't know if you're still with us. What strikes me, it's interesting what you mentioned about the 3 elements. Resource availability, resource coordination, but also the method and the modality of how those aids will be actually, be mobilized in a way that will strengthen public institutions. I think this is a very, very important note. So my question to you, we want to know from you, what is currently being done to ensure that effective coordination among various stakeholders are taking place between government, non-governmental organization, international partners, so we can have much more coordinated, unified response plan. I think this is important. And at the same time, from your experience, what are really the biggest obstacles now? If we say, okay, if we want to scale up our emergency response plan, unfortunately, this crisis, we don't know when it will end. Every day things are getting worse and worse, and we're getting to our limits. So, scaling up that response plan, what is needed from the international community, but going back to your point about the coordination, what is being done so we can have really a much more effective response, and we can mobilize the funds and aid in a way that reach the people, but also does not compromise also the resilience of our public institution. Over to you.
So let me start first by saying that this issue has been discussed by some, and some have even claimed that there is a reason why some of this aid will not come into the public institutions, and it is related for political motives and other things. What we sometimes read as a blockade. To be honest, Anna, I don't believe in this, and I don't think that this is the reason. I think the main reason why sometimes there is reluctance by whether the international community or some of our local community is an issue of trust. It is an issue where, people raise the question is, does the government, is it willing to do this in a way that is transparent? Is it willing to lead in this in a way, that allows trust to be, gained? Remember, trust is had and not given. So I think that the response of the government, whether in what Minister Yassin has done through the disaster response and management, or with what we are doing at the Minister of Health, has really shown that the government is willing to take the initiative. It's taking the responsibility. It is the one on the ground. It is coordinating. So I think that of course, there are, resource issues. There are a lot of, we might not be able to deliver everything that people want. At the end of the day, we are paying for the, almost a decade or 2 decades of this absence or of investment in public institutions. But the most important thing, in my opinion, is that there is something being done on the ground and it is transparent. Now here, there are 2 responses that are becoming, in my opinion, are important. First is how much is the international community is willing to acknowledge this and to come to the table and say, yes, I can see what you're doing. This is very transparent and so on. And I want to work with you. We're not asking for the resources to be handed over. But what we're saying is we need to have very good coordination amongst all of us to it. So this is where the international community plays a role. The second is the local community. Now, unfortunately, in my opinion, we are hearing a lot of, within our own community of people, instead of looking at what we are doing, what the government is doing, what Nasser or myself or others are doing, and saying, yes, this is a good move in the right direction, and we want to see how we can help and move this all of us in that direction. We're saying that people are starting to, go back to old kind of sort of narrative that is completely inaccurate. Like, for example, somebody who went on the media and alleged that, millions of tons of aid is coming and it's not being distributed. I mean, what millions? There is, it's barely tens of tons. So here, I think also the role of the local NGOs and the local community, how much they can also support the public sector and how we can work together. Now, I'm very happy that, we have 2 very good examples of, partnerships on your panel, at least in the health sector. Dr. Faisal, as a academic, the cooperation that we're having with AUB along with the Ministry of Public Health, which I think is a model for how can academia and public health can work together. Right. And Dr. Zena, who is also with her NGO, with the NGO that she leads, is also a very good example of when we sit together on a table and we plan together how we can have this fruitful relationship that at the end results in good things happening to patients. And I think that what is important is, this coordination, this kind of working together, which is, I acknowledge, I admit that it is still in the beginning, but it needs to be supported. It needs to be helped as we move forward.
Yeah, this is a very important point, because this is part of the learning and adaptation we're doing. But also, I like what you said, we need to be supported. This is very, very important. I'm so delighted to know about all those engagements taken. Welcome, Dr. Yassin. Dr. Zain, I'll come back to you, but again, I want to get to that perspective from the public sector, and then I will go to NGO. Dr. Yassin, I want to remind everyone, Dr. Yassin is the head of the National Disaster and Crisis Response Operation Coordination Committee. He's the Minister of Environment. I have to tell you, he has been really working day and night and to ensure, despite all the limitation and the constraints and the risk associated with working under brutal aggression, he has really working. I don't know if he's having time to sleep, and like Dr. Abiad as well. So Dr. Yassin, I wanna go to you, and I think you know, you have been involved a lot with the significant displacements. We mentioned we have around 1.2 million people that are really displaced all over Lebanon. You know, and we would like to get more of I know there was a response plan, but I assume that nobody had expected or imagined that large scale of displacement that we will have. And and it went so fast. So what are the immediate steps that are being taken to ensure the, you know, emergency shelter, basic needs like food, like water, like sanitation are all met? What are some of the challenges that you are actually, you know, seeing and living on a day-to-day basis, but particularly in the underserved areas, in remote areas, in high risk, hard to reach areas? Want you get your perspective before we talk a little bit about also the international community and the partnership, because there is another dimension would like to get your thought into it. So let's start by this one, Dr. Nasser.
Thank you, Professor Jardali and everybody. And I was listening to Mr. Abiad, and apologies the technical issue of WebEx. Since I left AUB, I forgot about WebEx, so now we're back to learning how to do it. As you rightly put it, Fadi, this is unprecedented by any scale. This is unprecedented by any previous war we have witnessed in Lebanon. And in terms of the scale, the speed, the intensity of the aggression, we haven't seen it before. So, you know, as much as you're prepared for an emergency response, and of course, we had a lot of challenges being prepared for such scale of a crisis and displacement and aggression on Lebanon. We had a chaotic few days, which is in some ways expected, but of course, the scale and scope and the speed of the war was unprecedented. Imagine quarter of your population moving from one place to the other. Imagine, for example, 70 million people in the US moving from one state to another state. The last couple of weeks, there was a hurricane in Florida. There was the same scenes we've seen of people moving and, you know, on their cars. So, you know, wars such of this scale and scope with an aggressive enemy hitting us, you know, in this manner, you would expect a chaotic response in the beginning. But we managed in the first few days, after absorbing this large displacement, to open collective shelters, reaching 1,138 today. Around 44,000 families are now in collective shelter, but the majority of people, 174,000 of households, of families, are in houses. So that's, again, another indication of the civil society, the community spirit, and the collective nature of people welcoming their, you know, other citizens in their villages, in their towns, and so on. So we initiated the emergency response, the national emergency response, but this is fully in collaboration with UN agencies, because we knew from the beginning when we started planning for such a response that we are under-resourced. As Mr. Abiad mentioned, we are under-resourced financially, but also human. The last 4 or 5 years had their massive toll on the public sector. A lot of people have left, salaries were slashed, people who used to earn like $2,000 or $3,000 a month were earning $100 or $200 a month. Under-resourced administration cannot manage a response or a crisis of this caliber. So we invited the UN agencies to be fully part of this, and this is a joint work. We are fully collaborating with them. And we initiated, as I mentioned, the response. And the response at the moment is focusing on life-saving, particularly food, health, water and sanitation, nutrition, basic assistance for the shelter. And at the moment, the focus has been on the collective shelter. Of course, a lot of challenges, 1,138 collective shelters, mostly schools or educational facilities or public facilities, are not designed to host people, you know, for a long time. So we're working on the more critical now, after we secured in some way, and somehow, somewhere, you know, but still under-resourced to secure a lot for everybody. But food security now is being is underway, where WFP, in collaboration with the ministries and the local authorities, distributing almost 200,000 meals every day. The water and sanitation as well, with UNICEF and the Ministry of Energy and Water and the local authorities, and other things. But we have critical 4 or 5 issues at the moment. As the war has been, continuing, and it's a protracted displacement, we're focusing on 4 or 5 issues. The key among these, or the most significant, let's say, the right word, is winterization. We're entering winter. We're actually in the winter season in many areas in Lebanon. So we're working on different ways to secure the support during the winter for the people in the collective shelter, for the almost 45,000 families or 250,000 people in collective shelter. Today, we approved in the Council of Ministers to get fuel, diesel in particular, for 541 collective shelter places, place or are in an altitude of 300 and above, with a very well-designed, transparent system of distribution of diesel to these 541 places. And we're working with the UN agencies to supply the blankets, additional material, weatherproofing for schools. Even in some places, they don't have the heaters, and getting the heaters. So I'm giving just one example of the challenges, but there are challenges on water and sanitation. There are challenges when it comes to the communal kitchens that we need to support. There are challenges on provision of water and other stuff. I'm going to stop now, but this is just a bit of an intro to this.
Yeah, and all this has major public health implications. I'll come back to you, Mr. Yassin, because I want to talk a little bit about that, and also to talk the issues about the coordination. But after we hear from Dr. Zeina, and it's interesting, and particularly you also, Dr. Yassin, because you worked a lot with NGOs. We realize that this is a country, we have a lot of fragmentation, but at the same time, at the time of crisis, we come together. There's something that works, actually, at the time of emergencies and crisis. The question how we can really more institutionalize it and how we can build on that. So, Dr. Zeina, as an NGO, we've seen civil society groups, NGOs really are embedded in the community response. And Dr. Yassin alluded to, Dr. Abyad as well, among other governmental agencies. So in your institution, how is Amel Association mobilizing its resources and community network to meet the increased demands and the emerging needs also for aid? So what are really, if I ask you, what are really now, from an NGO perspective, what are the emerging needs and service gaps that you are now seeing during this urgent crisis? Over to you.
Thank you, Dr. Jaldalay. Thanks for FHS invite. And really, I need to salute Dr. Yassin and Dr. Abyad's initiatives. Really, their ministries, in addition to others, have been extremely active in responding to, as Dr. Yassin highlighted, Minister Yassin highlighted, the magnitude of what happened is really big. Like in our contingency planning, we were planning for increased IDPs in Saida, then in another phase to Beirut, Mount Lebanon. But unfortunately, we saw at one time all the contingency lines activated at the same time, plus influx to the north even. So as Dr. Yassin said, the magnitude of what happened is really beyond anybody. But still, the fact that everybody was preparing themselves for an increased response from October 8, 2023 allowed us a little bit of time to organize ourselves. And really the coordination mechanism set in place is unprecedented. Really looking back at all emergencies, really this has been a first to see that despite this, we're not saying it's ideal, but at least things are more in place. And there is a huge effort to try to decrease duplication to a very high extent. So as highlighted that the big number is in schools, unfortunately, the bigger number are with the host communities. And this is where we highlight the solidarity, the resilience of the Lebanese. But unfortunately, since we have been here for 5 years in protracted crisis, we need to have multi-sectoral approach of response plus multi-population approach. And this is what's happening to try to address, for example, in one collective shelter, one school supporting health plus education plus child protection plus basic assistance plus food. So this is the model that we are all trying to follow, where we are coordinating with the Prime Minister's office led by Minister Yassin in coordination with the Ministries of Health, Strategy, to ensure the model of primary health care plus the additional support. So now the urgent need that you're asking about are the fact that winterization is a big issue. We have seen also at the health level increase due to the fact that the collective shelters are not prepared with water sanitation, which are in progress, the increase of infections, skin problems like lice, scabies. Also, we have seen big problems of now due to the cold and overcrowdedness, the respiratory diseases that could go really fast with the COVID, the flu that could really spread hard, and people who are on non-communicable diseases that where their needs need to be addressed in a fast manner. And this is where really the strategy of the Ministry of Public Health to link the mobile modality to the existing primary healthcare centers has allowed this comprehensive approach, plus the previous flexibility of allowing to have the Phoenix, the database of the ministry within these mobile modality that allowed for a continuity of care wherever people go. And as Minister Yassin highlighted, that the war is still ongoing. It's not like the explosion when it stopped and we can know the scenario. It's an ongoing scenario that
needs are changing on a daily basis.
So how we are responding in Amal Association is in a comprehensive approach. First, with definitely basic assistance and food support. We have increased our mobile medical units from 8 to 24 that are trying to cover the biggest area. Already 10 of our centers were hit. 2 primary healthcare out of function. So we are trying to operate in the ones that we have access, plus through this mobile modality and going into areas where we were not previously, like the north, Jbeil, etc., to address other needs. Mental health support, psychological first aid, psychosocial support. Children that have traumas need to be supported through specific case management, plus child protection through recreational activities, specific programs for older people, and also addressing the educational component because we don't want to have a lost generation. So this has been really big.
Significant number of needs, honestly, Dr. And I just wanted to remind everyone that when you mentioned, really, I mean, one of the, for example, primary healthcare network in Lebanon, this is mostly not owned by government. This is mostly really, faith-based organizations, civil society groups, NGOs that are really working hand in hand with government and all actors, and they are actually playing a very important role in the response, and certainly with all the significant work that Amel is doing. I want to go to Dr. Kak before I go to Dr. Yassin, because we want to talk a little bit about the international partners. Dr. Kak, going back again to women and children, and the issue that, and we know how much this is really now, this crisis is impacting access to everyone, but also there are vulnerable groups like women, like children. From your perspective, I know with the leadership on the Ahali initiative at FHS, as well as working with the Ministry of Health, what those innovative strategies now that you are really deploying to overcome those existing barriers? Particularly, we have a large number, as Mr. Yassin mentioned, large number of shelters, and there's a lot of need out there. So what are the innovative strategies you are using to overcome those barriers to access, and how this can be integrated? How this can be integrated, institutionalized, and scaled up in actually making this response much more effective and in real time?
Thank you, Fadi. I think as Dr. Yassin and Dr. Abyad mentioned, there is a very efficient coordination this time compared to previous wars that we have lived. There is really very efficient coordination, and I think we are still in the acute phase, and we are at one point going to go to the protracted phase.
Yeah.
So I think what's happening now is we have to strengthen the mobile clinics and the pop-up clinics.
Yeah.
That's really being conducted very well under the Ministry of Public Health. This is very important to keep. We have to activate any form of digital health and digital platform using telehealth to reach out to this really massive amount of displaced people. Dr. Yassin mentioned we're close to 1,200 shelters, but also there are many families who are within apartments and other places. Also, you have to reach out to this through telehealth. It can be really a very good component. We have also, Fadi, to come up with a more flexible streamlining kind of system, whether streamlining all the aid international and local, and also streamline the supply chain. I know very well in relation to reproductive health, this is really going so far very good, but we have to avoid exhaustion. You have to avoid later on any kind of interruption. That remains very important. The other important thing is also to think really seriously within these shelters of ensuring safe spaces, because you want to avoid gender-based violence, you want to avoid all types of attacks or harassment or any kind of structural violence that might be falling on women and young girls. These are really essential components. As far as for pregnancy and childbirth, I believe, from what I know, that the process is going very smoothly. The government is not only ensuring a smooth referral to these hospitals and centers, but there is also financial support, whether from the ministry directly or from other international organizations contributing to a certain percentage in terms of the financial support. It remains very important, as I said, is to strengthen again the existing mental health support. The national program within the ministry, along with other NGOs that are specialized in mental health, is really developing, and we have to strengthen this, the trauma-informed care that's really very much needed to mitigate the impact of this war on mental health.
Very important. I want to go, Dr. Yassin. Dr. Yassin, I just wanted to, I have to say, I can feel with you, because Dr. Abiad mentioned the narrative, wrong narrative that is actually happening. That Lebanon is receiving a lot of aid, where they are going, whatever. And I know you have been working very hard, including mayors, governors. I mean, everyone that is really within the public administration, that they have to be involved. And also, I mean, the amount of aid that we receive is so limited in comparison to the needs. Now, so I wanted your thought again in just a few minutes, because I want to, before we wrap up, and if there's any Q&A, but the effective coordination part. We're receiving those aids, those assistance. The question really, what do you face now when it comes to the deployment, the coordination among different partners to reach out to the people also in real time, and at the same time, again, what is the way, the condition the international partners put for allocating the funds from the Paris summit, among other aid that we're receiving? Is this really a facilitator or a barrier? Is it because they don't have a trust in the Lebanese government? They want to actually channel other way? And is this something good in order to actually overcome certain bureaucracy, because we have immediate needs? So what's your thought on that, and what is your message to the international community in this sense? Over to you.
Very good, thank you. I mean, a bit of very quickly, in the interest of time, there are three ways of supporting the displaced at the moment. The largest among them is the joint response system that we put together with the UN agencies, led by the Office of Humanitarian Affairs, OCHA, and the different agencies. So this is where most of the assistance is going at the moment to the collective shelter. This is mostly the flash appeal that we launched together with the UN a few weeks ago. And the bulk of the Paris conference was actually to fund the flash appeal and additional needs for the response. So now this is being funded by donors, by the EU, by the US, European nation states, and other donors, and we're in full coordination, as Dr. Faisal mentioned, as Dr. Zena mentioned, with the agencies, and we've established a quite good coordination system at the central level or at the local level. All within the government, agencies and ministries, whether at the Council of Ministers or at the governor level, at the local level. The second one, which we started receiving a month ago, is from friends of Lebanon, mostly Arab nations who've been very supportive, and we're really grateful for them, and other friendly nations with Lebanon. This is in kind. It's coming mostly to the airport, but also recently to the port. And everything we got with the Ministry of Health, most of it actually, I mean, more than 50% of it is medical supplies. But as Dr. Abyad said, you know, the airplane carries 50 tons, sometimes much less, sometimes a bit more, depending on the design of it. 50 tons are 1,000 boxes, give and take. So, you know,
People think 50 tons is really a large amount to meet the needs.
no, but some
Absolutely
people, I mean, I had today on the record a member of parliament saying 4,000 tons an airplane. This hasn't been designed yet for an airplane carrying 4,000 tons. I mean, even a ship, the ships we got are 2,000 tons, 1,000 tons. So there is misinformation, but there's also high expectations. And the high expectations is coming from the reality that people are in need. And that's what we need to manage with them, to manage the sending aid and to manage the expectation based on the resources we have. So at the moment, all the aid is coming in kind, is going through a system we created. I'm talking about the relief, the non-medical, to the governance. We put this very transparent. There is a dashboard that everything is put there. Even we scan the receipts of these items, and they go to the government. Governments distribute them to local authorities, and in turn they get them to people and to sign that they received. So, but still around 28,000 boxes have been sent in the last couple of weeks, and we're sending. I mean, we're still getting, and we're grateful for this support. The third line of support is coming from government institutions. High Relief Council, in the budgets they have, the Council of the South also has some budget, other ministries sometimes. And this is also, we're following up with those government entities to be also fully transparent in the delivery of aid, and particularly to collaborate and coordinate with the local governors and local authorities. But you know, now we went to Paris, and I was following also Paris and Geneva last week, and we're following meetings and follow up to this. The response and the pledges from 70 countries, and grateful for France and for President Macron for hosting this, was really good. I mean, 800 million for aid. But the essence of this is really to follow it up, because pledges are pledges until they become reality. And to become reality, we're working hard with the allied ministries, with the UN agencies, to go with the follow-up meeting, with bilateral discussions.
Very important.
Very important. And we're very transparent about that. And we're fully okay with the aid coming through UN agencies, but we want to prove that the government is in the driving seat. You know, the government cannot be in the back seat, like what happened after the Beirut blast. We need to be in the driving seat, fully coordinating with the UN agencies and local NGOs and everybody to show that it can work. And this is key, you know, supporting public institutions and supporting the state is a key message of what Dr. Abyad and myself have been working on in the past few weeks. You know, we want to show that the government can work. It's challenging. We have an issue of trust. We have issues of efficiency. We have a hollowed out public sector, but we want it to work. And the concern, if we don't get the public system and the public sector to work, it might fall altogether. And it's very fragile at the moment. It's been fragile for many years, but particularly for the last 4 years. If that war gets to be chronic and protracted, it means the fragility is going to be even, more visible. And a collapse of the system of Lebanon, as weak as it is, means the spillover is going to be on everybody, including Europe. And add to it, the rebuilding cost of it is going to be huge, as we've seen in other nations or other experiences.
Absolutely.
So this is the message. We're fully collaborative and collaborating and open with everybody, but we want to keep the centrality of state institutions in every discussion, as challenging as it is, internally and externally.
As if what you're saying, Mr. Yassine, that we want this system to be efficient, to be effective, but also want it to be institutionalized. We want it to be scalable, and not at the expense of public administration, not at the expense of governmental institutions. And that's where the role of international community comes in. They have to take and they factor this in of how this can be. We can do this type of emergency response and provide the aid, but at the same time also strengthen our institution. Lots of learning that we have actually to integrate as we are doing this type of response, and hopefully to strengthen governmental institutions as we move forward. I know we have just a few minutes. Unfortunately, we're receiving a lot of questions on the chat. Fantastic question. I tell you, every question can actually take a seminar or webinar, one on education, on food security, on public health, a lot on AIDS. And I know, Dr. Yassin, you've already, just for people to know, the government is putting a dashboard. And what Mr. Yassin is saying is very, very precise, that they are disclosing everything that they are receiving, how this is being allocated, the dashboard is there. Unfortunately, there is a wrong narrative that is being built around that. The demand and the needs are really big. Public health, education, food security, you name it, all sectors need immediate help. I think we're learning, we're all government institutions working together. Before I finish and wrap it up, Dr. Zena, I tell you from an NGO perspective, in 10 seconds, what are really the immediate measurable action that you need to prioritize for better response from an NGO perspective? 10 seconds.
Yes, now at the beginning of an emergency, first we address the emergency needs, which are the relief, the basic health, etc., the child protection, etc. But we know that, and Minister Yassin can correct me, we only receive 20% of the total needs. We are using the resources wisely and doing austerity measures, and the frontliners also, their well-being is being addressed, that we need to ensure. But what we call is to increase the resources and the support to Lebanon, and the really joint call to look at Lebanon and at the civilians that are directly hit, because also there are a lot of fires that are not addressed, which are long-term also, which is the use of the phosphorus, possible use of the depleted uranium that could cause health issues on the long term. So big attention to these immediate and survival components, health and all the social determinants of health around it, to ensure the well-being of the population. Thank you.
Thank you, Zena. And we have the request, Dr. Yassin, if you're still with us, that the link for the dashboard that we mentioned, I think if this can be, I'm sure it's already there, but if somebody asks for it, if it's already available to be shared, or maybe later on. Dr. Kak, also in 10 seconds, please, what would be that priority action that you are actually wanting to voice, particularly for a national and international community?
5 seconds, don't worry. And I think as academicians, we should keep on informing the government and the whole coordination of the work about important needs and important key points to keep the process efficient and to keep the process effective.
Yeah, and I think this is a great message, because this is really the strength of Lebanon. This is the strength of all the stakeholders, academic institutions, EB and other academic institutions, faculty of health sciences, that really at the front, trying to actually support and work with all partners. As excellent examples, we have people like Mr. Yassin, Dr. Yoid, and others that are really working very hard, and they believe in that engagement of government and academia engagement in this type of response, including for the NGOs. Also in 10 seconds, Minister Yassin, excuse me of saying that, but do you have one last message you wanna say before I close it with Abla?
The first thing, I added the links on the chat. So the message is in Arabic, but the links are available. Some of them are slow because a lot of data, so opening them on a laptop is better until we're fixing some technical things related to using it on the phone. I mean, the message I mentioned, that the protracted nature and the aggressive nature of this war is definitely putting a lot of challenges. So the first thing that we need to make is to push and lobby and advocate to stop this war. This war has been waged on aggressively breaking and violating all international laws, international humanitarian law, international law, Geneva Conventions, all protocols, no respect to the environment, no respect to the cities, no respect to, first and foremost, to civilians, to health workers. I think this is always need to be reminded, and to say it clearly, without any diplomacy here. Even if we are in certain institutions, but we're saying this is the right to say it, and we need to fight for it. A ceasefire is a must, and this has to be today before tomorrow. The second one And there's a term with Dr. Fuad, whom I just noticed he's in the webinar, the chronicity of the crises. And this has been happening in Syria, in Palestine, and now in Lebanon. And if this becomes more and more chronic and protracted, the test for any system, including the humanitarian system, and the shelf life of humanitarian systems are not for long. They are for a few months to keep, sending boxes and wash and water and sanitation assistance and food security and so on. We really need to think of stopping the war, but secondly, keep the services, social, health, basic urban services functioning. If we leave those services that they're under a lot of strain at the moment, this means the system is going to collapse altogether, and it's going to be hugely costly to rebuild it or to recover those services. I'm talking about health, education, social, even cleaning. People living around AUB know very well the strain on the neighborhood of Ras Beirut. So how to manage all of this? This was put in Paris conference, and we're continuing a dialogue with donors, with municipalities, with UN agencies to support those basic and social services in this time of emergency until we move to the early recovery and to the day after.
This is very important, talking really about this phase, but also in terms of recovery phase. And to add to what you mentioned, Mr. Yassin, I think also was reminded by some of the questions that also it's important also to start talking more and more about the environmental impact of war, with the type of bombing, the type of weapons that are unfortunately being used by Israelis, and what that means to the environment, what that means to the agriculture, what that means to our health. So it's a lot, as you mentioned, all sectors. And I know we took extra few minutes we promised you in 60 minutes, but I have to tell you, this is just the start. I think there's a lot of things that come, a lot of insight that came out from this, even from a research perspective, even from implementation research perspective, a lot of things that we actually to unpack, we need to understand, we need to do. I think this is a really, we have to take that moment to reflect on the powerful, I would say, insight that came from this session. I think we have huge displacement, we have terrible disruption, we have a collapse of all the vital services, and we have really countless families that are really in need. This is a time where we come all together, national, local, NGOs, government, non-governmental, international communities. I want to thank all the speakers, participants, partners from all around the world for being here. I think I urge each one of us, really, I urge each one of us to carry forward the urgency of this moment for Lebanon. I think all of you in this call have a role to play, not only Lebanese. I urge you to carry forward the urgency of this moment, to act swiftly in your scope of work, scope of influence, scope of control, to act together, but also to act with compassion. I think that's what we need more and more. We need a humanized world. So let us turn those words into action, our commitment into result, and hope for real, tangible change, all working together. This is just the start. We're going to be working together as we move forward and strengthening this type of response. Dean Sibai, your last word to you before we close.
Thank you, Fadi. I also want to thank our esteemed panelists and all the participants from across the world. As you mentioned, this has been a very valuable and insightful webinar from people who are in the front lines. We have been learning from our experiences before in the earlier crises, and we are learning more in this. There's better coordination and better work in the field. There is a lot of role for us, public health professionals, to work on the issue of trust, with many of the panelists have raised the trust by the international agencies and trust by the local communities. These are one of the key messages which I thought that we as public health professionals can work at. One last word. I mean, the weaponization of health and injuries continues in this war. This is a very ruthless and a lawless war. And as you mentioned, Fadi, every one of us has a role over here to raise our voice and demand an end of this war. There is nothing we can do if we don't end this war.
Thank you.
Thank you so much.
Thanks for all the panelists, and apologies again for taking extra 5 minutes from your time. Thank you.
Thank you.
Have a good day and a peaceful day.